incredibly generous. That was an incredibly generous introduction that I hope I don't make all of you shake your head and go, she was just wrong about. But thank you for coming back, and thank you for joining us in what I'm calling the second presentation in our how presentations. We had a first one talking about why supported decision-making is important. We had a second one talking about how you can use supported decision-making in special education. Today is all about how you can use supported decision-making in vocational rehabilitation. Spoiler alert, vocational rehabilitation is my favorite program for people with disabilities. And I say that knowing that people across the country, when they hear vocational rehabilitation, roll their eyes and think they never do anything or they can't help me. What I want you to know today is that you don't have to roll your eyes if you know your rights. I'm going to show you how vocational rehabilitation can have an incredible impact on people's lives, not just about work, but about independent living skills and quality of life. So with that in mind, let's begin. As I've said, this entire presentation, as part of this entire series, are ways to use supported decision-making in the supports and services that people with disabilities use every day. And as we did before, if you have questions, please put them in the chat box. Morna, if you see a question that is interesting or pertinent, interrupt me. I absolutely want this to be as interactive as possible, knowing that it's hard to be interactive over Zoom. So if it's important enough to ask, it's important enough to interrupt me, and we can always get back to the slides after that. I promise I will stay as long as you have questions. So beginning with an article of faith. I always like to begin with articles of faith, things that we know, that we can empirically prove. We don't have to make them theory. They are fact, and it is this. People with disabilities who exercise more self-determination have a better quality of life. With regard to this presentation, most importantly, people with disabilities who have more self-determination, and remember, that means they have more control over their lives. People with more self-determination make more choices. They do more things. They are the causal actors in their lives. So what we know from decades of studies is that people with disabilities who have more self-determination are more likely to work, and they are more likely to earn more money. They're also more likely to be more independent, be better educated, and have more community integration. But for today, remember, self-determination equals greater employment opportunities and higher wages. And how can we get to self-determination? If self-determination is all about making choices, then a great way to get there is supported decision-making, because supported decision-making is all about making choices. On your screen is the big, long definition that I told you I don't like very much, even though I wrote it, about how supported decision-making is a recognized alternative where people work with friends and family members and professionals to help them understand the situations and choices they face. In actuality, all you have to know about supported decision-making is this. It's getting help when you need it from people you trust to do the things you have to do. In other words, it's what we all do every day. There's zero doubt in my mind that you have used supported decision-making today, each and every one of you. I know for a fact that I've used supported decision-making multiple times today, because when we ask for advice, when we ask for assistance, when we ask someone to explain something to us, when we ask someone to research something with us, when we ask someone to help us solve a problem, we are using supported decision-making, because we go to someone we trust to ask them to help us out, to help us understand something. The best example I can give you is this. The last time I was qualified as an expert to testify, and I use expert in quotes because to this day, it's still kind of funny to me. But the last time I was qualified as an expert to testify, I was asked, what is supported decision-making? And I told the judge, you just did it. There was something that you didn't know. In this case, what supported decision-making is. And you went to someone you felt did know that, me, and asked for help understanding it so that you could understand it and do something with it. That's what supported decision-making is. And again, think of all the cliches we have in our lives that are all about supported decision-making. We tell each other, don't make a snap judgment, don't go off half-cocked. We advise people to make an informed choice and get a second opinion. It all means the same thing. Get the help you need to do the things you have to do. That is what supported decision-making is all about. And here's what we know from research. We know from research that's been coming in the last few years is that when people with disabilities use supported decision-making to make their own decisions, instead of having people make decisions for them, they're more self-determined. And that's hardly rocket science, right? If I'm making my own decisions with support, instead of having someone else make decisions for me, I have more control over my life. I'm making more choices. I'm more self-determined. And what do we know about self-determination? It is directly correlated to quality of life. That people with disabilities with more self-determination have better lives, more independence, more education, more employment, more community integration. We just showed that in a study that we completed at the end of 2020. I'm currently working on the journal article about it, but you can see the published results at the link on your screen. We worked with 10 young adults with intellectual disabilities, and we taught them about supported decision-making. We showed them ways they could use it. We didn't tell them how to do it. We just told them what it was and encouraged them to work with family members and supporters. And then we said, go do it. Go put it in place. And we collected data for them from a year. We spent a year collecting data. You know what we found? It's not surprising that the people who used supported decision-making were more independent, more confident, got better at making decisions, and according to their family members and friends, made better decisions. And even in the middle of a pandemic, the majority said they were doing more things in their community and joining more clubs. So supported decision-making is a way that we can get to self-determination. And when we get to self-determination, we get the benefits of self-determination, like more work at more money. And that's why I can honestly say I have never seen anything take root in the disability community, also in quotes, as fast or as deeply as supported decision-making. If you put an inflection point on when supported decision-making hit the public consciousness, it would be that Jenny Hatch case I told you about, the person I was lucky enough to represent. And Jenny caught the public eye and was in People magazine and on TV and all that. But in just 8 years since then, that was just 2013, in just 8 years, 14 jurisdictions, 13 states and Washington, D.C., including Rhode Island, you have one of the best laws actually, have passed laws formally recognizing supported decision-making. And all these organizations you see on your screen, the U.S. Department of Health and Human Services, the American Bar Association, the National Guardianship Association, and interest and advocacy groups like the ARC and NAMI and DASAN, covering across the spectrum of disabilities. The AARP joined me on an amicus brief about supported decision-making. So across the spectrum of ages have all said supported decision-making is something we should try. Why? Because it makes people's lives better. So with that as an introduction, knowing how important self-determination is, wouldn't it be great if there was a program that could provide all of the benefits of self-determination, but was also available to all people with disabilities? And I mean all. I mean, if you think about the programs available to people with disabilities, they are very often limited in scope. Special education you have to qualify for. You can have a disability and not get special education eligibility. Medicaid waivers, you have to be a specific level of disabled and have a specific level of income. For all of these programs, you have to meet qualifications. Wouldn't it be great if there was a program that was open to every single person with a disability and provided all of the benefits we showed about self-determination? There is. There is. It's called vocational rehabilitation. I am going to call vocational rehabilitation VR for the rest of this presentation, because frankly, it's easier. VR is vocational rehabilitation. What is VR? It is a law that has been around formally since 1973. The actual first talk of rehabilitation and vocational rehabilitation was after the Civil War. but we've had a Rehabilitation Act since 1973. And for those almost 50 years, what the Vocational Rehabilitation Program has been focused on is helping people work. That is the focus of the VR program. In fact, what the law says from the last update of the Rehabilitation Act is that the whole job of VR is to provide supports and services to help people with disabilities prepare for, secure, retain, advance, and or regain employment. What that means is get ready to work, get a job, keep a job, advance in a job, or get a job back. And that is the thing about VR. If it will do one of those things, if people with disabilities need assistance to prepare for a job, get a job, keep a job, advance in a job, or get a job back, then VR is there to provide supports and services. In fact, they are required to provide supports and services. So first question, what does that have to do with what we've been talking about so far? We've had a bunch of talk about guardianship and supported decision-making. I mean, this sounds great. It's all about work. What does it have to do with guardianship and supported decision-making? Well, what if the same things keeping you from working, keeping you from getting a job, keeping a job, advancing a job, are the same things that are pushing you into guardianship? What are they're the same things that stop you from quote unquote taking care of yourself? Well, if that's the case, if you need something to work and that thing will also help you in life, then VR is going to provide it. That means anything. If you need assistance with your decision-making and self-determination skills, because those are keeping you from getting a job, keeping a job, advancing a job, VR has to provide it. So VR can do more things for more people than any other program, because we can make anything about work. Because if we want to work and there's something stopping us, then VR is required to help us get the support and get the services we need to overcome those, what they call barriers to employment. So how do we get VR? This is another reason why I love the VR program, is it is incredibly easy to be eligible for VR. You are eligible for VR if you have four things. One, you have a disability, any disability. Two, that disability makes it hard for you to work. It puts a barrier. There's something related to that disability that makes it harder for you to work, to get a job, keep a job, advance in a job, to maximize your employment potential. Three, you want to work. And four, there's VR services that can help you do it. I have been told by the federal government agency that oversees VR, that means 98.5% of people with disabilities should be eligible for VR now. And here's the thing, if you're receiving public benefits, SSI, SSDI, Medicare, Medicaid, food stamps, you are presumed eligible. That means they have to prove that you make the first three of them. You are presumed to be eligible. So anyone on Medicaid is presumed eligible for VR. It means you have to assume they can work. And in fact, it's really hard to be ineligible for VR because the regulations, and you'll note I'm putting regulation sites on every page because that's important. The things I am telling you are not theory. The things I am telling you are coming directly from federal law, from the Code of Federal Regulations. That's what CFR stands for. If you type in 34 CFR 361.42 to Google, you will find the federal regulation about eligibility for VR, and you will see this criteria. If you look at that further, you'll find this. If you have a disability, any disability, the agency has to presume you want to work. The agency can't just say you're too disabled to work. If the agency thinks that you might not be able to work, that you might be too disabled to work, you know what they have to do? Give you a chance to work. That is a thing called trial work experience. If they think you might not have the skills or you might be too disabled, as much as I hate that phrase, to work, they have to give you a chance to work. They have to give you opportunities to develop the skills to work in an area that you have interest in. By the way, in case you've ever had VR experience, that doesn't mean they're allowed to send you to Goodwill and see if you can fold clothing. They're supposed to give you trial work experience in an area that matches your skills and interests. So if anyone ever tells you or someone you're working with, I don't think you can work, you seem too disabled, you say, give me trial work experience. These are the things I like to do. And one more thing, to be eligible, you don't have to prove you can work. They have to prove you can't, or they have to serve you. In fact, they have to prove by what's called clear and convincing evidence. Y'all have watched TV, you've heard of the beyond a reasonable doubt in criminal law. Clear and convincing is just below that. So it's the highest standard in our civil system. And VR has to prove you can't work in order not to serve you. Here's a quick story about that. I had a client, I used to be the director, the project director of the program in Virginia that did advocacy for VR clients. It's called the Client Assistance Program, and Disability Rights Rhode Island has an excellent one. So in the Virginia Client Assistance Program, I was working with a young man who had intellectual disabilities, and he applied for VR. And VR said, you're too disabled to work. Your IQ is measured at 39. Don't get me started on IQ. It's a ridiculous measurement, but that's what they said. You can't work. So we went and we appealed it because we said, you have to prove he can't work. You've never given him a chance to work. And my exhibit number 1 was his special education IEP, which talked all about his volunteer work. In other words, that he had worked. So of course we won that case because he couldn't prove, VR didn't even try to prove he couldn't work. That's what I'm talking about, why VR is such a great program when it's done right, because you can get more things from it. So in Rhode Island, the VR agency, remember every state has one, the Rhode Island VR agency is the Office of Rehabilitation Services, or ORS. They have a website. The link is on your screen. You'll be getting copies of this. Of course, you can share that. That's where you can find it, or you can simply Google Office of Rehabilitation Services, Rhode Island. You can learn all about their systems. It's actually not a bad website. I went through it. So if you want services for ORS, and something I have to stress to you, there is no age limit for VR. If you are 16 years old and you have a disability and you want to work, ORS should serve you. If you are 95 years old and you have a disability and you want to work, ORS should serve you. There are programs that have age limits. Special education is one. VR is not. VR is required to serve every person with a disability so long as they meet their educational, their criteria, those 4 tests. So I recommend to everyone that they apply for VR if they have a disability and want to work. And in Rhode Island, here's how you do it. There's their telephone number. There is their application, and you can mail it to ORS, or you can just call them and ask for an intake interview. What happens in an intake interview typically is they want you to show that you have a disability and you meet their criteria. It's not hard to do. You can do that by providing, for example, if you get SSDI, an award letter. If you're in special education, you can show them an IEP, or you can provide a letter from your doctor. They are supposed to then assess whether you meet their 4 tests. And remember, they are supposed to presume that you want to work. And if you're getting SSI or SSDI, they have to presume that you're eligible. So what if you're told that they are on an order of selection? On ORI's website, there's a lot of information about order of selection. So here's what you need to know about that. Under the federal law, the feds give states money for VR. And they say, in return for this money, you got to do what I said. You have to serve all the people with disabilities to provide them with services. When states run out of money, they are allowed to ask the feds to go on what's called an order of selection. Order of selection works this way. It allows the state to divide people with disabilities into categories, from the most to the least disabled, and then prioritize who they're going to serve. They are required to serve people with the most severe disabilities first when they're on an order of selection. I looked up whether Rhode Island is on an order of selection, and as of August of this year, which is the most recent federal records, they are not. all categories are open. But if you're told they are on an order of selection, it does not mean you should not apply. You should always apply for services, even if they're on an order of selection. And here's why. Number one, if it's a waiting list, and you can characterize an order of selection as a waiting list because they're going to say, we're only going to serve the most severe disabled first. So you have to wait until you get up to the top of the ladder. If it's a waiting list, you might as well get in line now because the categories open when they get more funding. So absolutely apply, but also there are still things they have to give you when you're on order of selection. So even if they say, we are on an order of selection, and I do not believe they are right now based upon the federal information, but even if they are, it's worth applying because there's things they still have to give you. They still have to provide you with information. They still have to link you with other agencies that can help you. They still have to provide referral services. So you can find more information on what ORS does with order of selection, including frequently asked questions, at the website on your screen. But I cannot stress this enough. Whether or not they are on order of selection, you should apply. The worst that's going to happen is you're going to be on a waiting list. So absolutely you should. It's an absolute yes, because the worst happens that you're in line and you still get the things they're supposed to give you. So once you are found eligible, and the eligibility process is supposed to take 60 days, they can ask for more time, but really, if you provide that documentation that you do have a disability and want to work, it should go pretty quickly. I've had many people found eligible the same day they apply. The first thing that's going to happen is you're going to be asked to complete an Individualized Plan for Employment, or IPE. What an IPE does, it's like a roadmap. Remember, we talked about the IEP in special education last time. The IEP is the plan for education that sets out your goals and objectives and the things you're going to get in order to reach your goals. Think about the IPE as the same thing for employment. The very first thing it does is you are asked to identify your employment goal. That is the job that you want VR to help you get, the area you want to work in. So you get to work with VR and pick your employment goal. The reason that's important is it's your employment goal. It is a goal that matches your skills, your interest, and your choice. Far too often, we hear about VR agencies pushing people with disabilities into certain types of jobs. I call them 4F jobs: food, filth, filing, and flowers. Time after time, I hear about VR suggesting that people with disabilities work in fast food, janitorial, light office, and retail. See it time and time again. And you know what? There's nothing wrong with that if that's what you want to do. Unfortunately, I've had case after case where people are told they can go to work in Chipotle. And I would say, if you want to work in Chipotle, that's great. But if I can do more, if I have more skills and interests, if I have the ability, then my employment goal should match what I want to do. I should say, no, I want to work in this field. Now, VR doesn't have to support every employment goal you fix. If I go to VR and say, I want to be a professional football player, they don't have to support that goal because it's inconceivable that I would be a professional football player. So they don't have to agree to an employment goal if it's impossible for you to get there. But if you can reach that, then they can't say you should do something else. Here's my favorite story on that. When I was in the Virginia protection and advocacy system, we had an attorney who worked for us who was deaf. The old phrase, severe and profoundly deaf, as they said. So she went to VR and she said she wanted to be a lawyer. And VR said, that's a lot of time and a lot of money. How about we train you to be a paralegal? She said, no, I have the skills and the aptitude to be a lawyer. I want you to support me to be a lawyer. You know what she did? She showed, based upon her skills and her grades, that she had the ability to be a lawyer, and they had to support that quest because that was her job goal. And you know what? Not only did she become a lawyer, not only was she a really good lawyer, last I heard, she was a managing attorney in the Georgia protection and advocacy system, fighting for other people to get appropriate supports. So that's the thing. Don't settle for an F job. Don't settle for a job that doesn't meet you when there is more that you can do. So once you have agreed upon a job goal, the next thing the IPE does is lay out the supports and services you need to get there. Okay, again, think about this as a roadmap. The end of the road is the job I want. Let's say I am that person. I want to be a lawyer. Well, what do I have to do to become a lawyer? I need college. I need law school. I might need books. I might need training. I might need whatever I need. We are supposed to figure out what is in between me and that goal. And the supports and services are supposed to be the ones that I need to get to that goal. So the IPE is quite literally a roadmap, and the supports and services can be anything. I mean, think for a second. This is one of my favorite VR exercises. I always say, think for a second, what are some of the things that keep people with disabilities from working? You don't have to say it out loud, but think about what are the main things that stop people with disabilities from working. I will guarantee at least 10 of you just thought transportation, because I have done this presentation across the country and I start a stopwatch in my head until someone says transportation, and it's always less than a second. Well, let me tell you something. VR can provide anything. What you're seeing on your screen is from my favorite regulation. And yes, I am geek enough to have a favorite regulation, but I beg you to remember this one when it comes to VR. That regulation is 34 CFR 361.48. You can Google it. You can remember it by saying 34 CFR 361.48 is great. And here's why it's great. That regulation lays out all of the things that VR has to do. I'm going to show you some of them later. But what you see on your screen is just a small list of some of the things they have to do. There's a list of about 22 different supports they must provide if those things are needed to help the person meet their job goal. Look at what's there. Assessments to figure out what you need. Counseling to help you figure out how you're going to get there. Job search and retention services to help you find the right job. Assistive technology like computers and in some cases repairs and adaptations to your car. Medical and mental health care if you need that, including medications, including assistive technology, including durable medical equipment if that's what's stopping you from working. On the job training with job coaches. And yes, there's the biggie, transportation. Everyone always says transportation is what stops people with disabilities from working. Well, under VR, if transportation is what is standing in between you and working, then they have to provide transportation to you. That's correct. Whether that is a taxi or finding you a driver. And they have to also provide services to your family if that's stopping you from working. If you need daycare, because without daycare, you can't work, or services to an adult family member, an elderly parent that's stopping you from working, they have to provide it. All of this is in 34 CFR 361.48. In fact, the last one in that long list is anything else a person might need to work. So these are just some of the things I have gotten people under VR. Not because I'm a genius, mind you, but because I can read. 34 CFR 361.48 makes this really, really clear. So 36, that reg says anything else. So I have gotten people temporary rent because it's awfully hard to find a job with no fixed address. I've gotten VR to purchase clothing because it's hard to go through an interview if you have nothing to wear. We've gotten therapy, and I mean physical, mental, behavioral therapies, because those are things that were in the person's way. They weren't able to regulate. And in one case, I even got dental work because that person was a quadriplegic and actually was able to type by having a pen in his mouth and would be able to type that way. And we showed he had the ability to be a data entry clerk. The problem was he had worn down his teeth with the pen. So he can't get a job unless he's able to type. So they had to pay for the restorative dental work. That's the amazing thing about VR. If you can picture it and it will help you work, they have to provide it. About the only thing I have ever heard that they haven't had to provide was like modifications to your house. And I got to tell you, I would take on that case. If I needed a ramp to get out of my house in order to get to my job, I would suggest that was a barrier to employment. That's about the only thing I've heard that might not be able to be covered. And here's a big, giant one. This again, in 34 CFR 361.48. Vocational and other training services, including the provision of personal and vocational adjustment services, books, tools, and other training materials. That means they got to pay for college if it's appropriate. That means they got to pay for technical school if it's appropriate. And in the case of the person I knew, they paid for law school if it was appropriate. Because if what is standing in between you and your job is training programs, then they have to provide those training programs, whatever they are. Now, look, VR is not wish fulfillment, okay? You still have to prove that the things you need are necessary to help you work. You can't say something like, I need college to learn life skills. VR loves to deny people who are looking for life skills programs. You have got to tie it to skills you need to work and to work in your job goal. So here's my example of that. And this covers two good VR examples. I had a client whose job goal was senior engineer. And VR agreed to that job goal, senior engineer. Well, it turns out he was promoted to engineer. And they said, good news, we don't have to serve you anymore. You met your job goal. Not true. We said he wanted senior engineer. And it turned out in his company, senior engineer required a master's degree, required advanced training. And we said, in order for him to meet his job goal, he can't get there without this training. And they had to provide it. Now, again, not wish fulfillment. There is times when VR can say, we're only going to pay for part of it, or we want to see how much money you're making to see if we have to pay it all. It's called means testing. But if you get SSI or SSDI, if you get Medicaid or Medicare, they can't do that. If I am an 18-year-old and I just got on the waiver and I live with my parents and my parents make $1 million a year, it's still about me. I'm getting Medicaid. They can't say your parents make money, so we're not going to serve you. I've actually litigated that one. So the thing to remember is this: 34 CFR 361.48 talks about all the things VR has to do. It has all the supports and services they have to provide and all of the things that they can do. And what you need to remember is if it's directly related to your job, if it is going to help you get to that job goal, they have to provide it. Subject to the limitations of money, if you have to be means tested, and that it's directly related to your job. Because working is incredibly important because it's tied to quality of life. And this is an important point, and this is a sad truth. I told you that people who receive benefits like Medicare and Medicaid and SSI, they're presumed eligible, and the VR especially has to help them work. But the sad truth is so many people receiving benefits like SSI and SSDI are afraid to work. They're afraid, and they're rightly afraid, because under federal law, if you're on SSI or SSDI or Medicaid, you're not supposed to have more than $2,000 to your name. It's what we call the fiscal cliff. So people are afraid to work because they think if I work and I have more than $2,000, I lose my benefits. The very things I need to be independent, the health care, the supports I need to be independent, I lose if I work. So across the country, I have parents saying, my kid can't work because if my kid works, we'll lose our benefits, or he'll lose his benefits, or he'll lose his health care. So people who could work languish. Well, I'm here to tell you that VR can help with that. Because for people on benefits, one of the VR services, remember 34 CFR 361.48, One of those services is called benefits counseling. The whole point of benefits counseling is to help people on benefits manage their money to make sure they don't go over the fiscal cliff, or make sure that they are properly getting credit for expenses that will help them work so it won't count against their benefits. There are providers called Community Work Incentive Coordinators, or CWICs. The whole point of a CWIC is to help you manage your benefits, to help you keep track of your expenses so that one day you don't get the horrible letter from SSI that says we overpaid you by $100,000, pay us back. I've seen that. Disability Rights Rhode Island has a great program called PABS, Protection and Advocacy for Beneficiaries of Social Security. And I used to manage that in Virginia. We would find people who weren't working with CWICs who would get this bill. SSA would say, you earned too much money, you gotta pay us all back. And we had a whole litigation practice on proving that they hadn't earned too much money. Save yourself the trouble. Work with VR, work with a CWIC to help you work and keep your benefits. Because work is about more than just work. And VR is more than about just work. It's about self-determination, controlling your path. Remember, we started this by saying self-determination is the key to better employment, the key to a better life. So VR should be all about self-determination because it's directly tied to work. So how can we make it do that? And how does that have anything to do with supported decision-making? Remember, we tied supported decision-making directly to self-determination and self-determination directly to work. Well, think about what supported decision-making is. Remember, again, working with your friends, working with your family members, working with people you trust, so you understand your choices and can make your own decisions. Well, VR is all about that. In fact, VR is required to use supported decision-making with you. They don't call it that, but they are required to help you practice supported decision-making. When you work with ORS, they are required to use supported decision-making with you. How do I know this? Because there's a regulation on it. All VR agencies are required to help you use informed choice. 34 CFR 361.52. Here's what informed choice is. There's a definition on your screen. You can read it. It's fine. But I can do this even better. I'm going to say Morna is my VR counselor. I'm working with ORS. Morna is my counselor. Morna's obligation under federal regulations is to help me understand my options, to go through those assessments and counseling. Maybe I don't know what kind of job I want. Maybe I don't know what kind of supports I need. Morna's job is to explain to me what's available, to talk to me about my interests are, what my skills are, what my abilities are, to help me understand options about possible jobs. And once we have the job goal lined up, to figure out what the barriers are, figure out what the possible supports are, figure out what good providers are. The whole point of informed choice is that Morna, my counselor, helps me understand my options for job goals, my options for supports, my options for services, giving me that information in a way that I can understand it so that I can choose my job goal and I can choose my supports and services. In other words, Morna provides the support and I decide. That's supported decision-making. That is the definition of supported decision-making. So supported decision-making is built in to the vocational rehabilitation system. It is a key part of the voc rehab system. And since we know that informed choice is just like supported decision-making, we know that supported decision-making is correlated with self-determination. And we know that self-determination leads to higher work, better work at more money. So we should be not just encouraging supported decision-making. The VR system gives you a chance to practice it. And think about the benefits that can have in your life. If you have an opportunity to practice supported decision-making through VR, get better at using decisions and working with people to understand your options, that means you can use it in your life. That means you can use it in other situations. You can use it in your healthcare. Our next presentation is all about using supported decision-making in healthcare. So you have a chance to get better at it, because decision-making is a skill. Understand that. It's a skill. We all know that. The more opportunities we have to make decisions, the better we get at it. So having opportunities to make decisions through the VR process is going to give us a chance to get better at making decisions in life. And that's hugely important, because people are put in guardianship because society believes they can't make decisions. Society comes to this decision that people with disabilities can't take care of themselves. They can't make their own decisions. And that leads directly to guardianship. That's the standard for guardianship. You're incapable of managing your life. So what better way to show that you are capable and can make decisions than getting practice doing it through the VR system? So it's a huge point, especially when you think about all of the things VR can do. Because remember, I asked you that question before. What if the same things stopping you from working are the things pushing you into guardianship? What if you lack employment skills, job skills like self-care, job skills like organization and communication and interpersonal skills? What if those are the things stopping me from working? And I have gone to VRs across the country and said, help this person work because this person is terribly disorganized or doesn't take good care of himself. And VRs across the country have told me, we don't provide those services. Those are life skills. If you want independent living skills, go to a center for independent living. If you want independent living skills, get them through your school, get them through Medicaid. And I've asked the same question to VRs across the country and litigated it a couple of times. I've asked this question and you can too. Would you hire someone who is so disorganized, you know they're not going to be able to follow your policies? Would you promote someone who takes such poor care of themselves that they're always getting sick, they're messing up your materials and getting the coworkers sick? Would you retain someone who has difficulty getting along and alienates coworkers and customers? Of course not. If the answer to that question is no, you wouldn't, then those things, organization, self-care, communication, life skills, are employment skills. And if they are employment skills, VR has to help you overcome those barriers. If your barriers to employment are, I don't get along with people, I have a disability that makes me oppositional or defiant, then VR is required to help you overcome them. How can they help you overcome them? Remember 34 CFR 361.48. They can provide you with medical and mental health care. They can provide you with counseling. They can provide you with therapy services. So yes, life skills that stop you from working are employment skills. So that's what VR can do. That's what ORS can do for you. Whatever your barrier is to employment, ORS is supposed to, and in my opinion, must provide supports and services to help you overcome them. And they do that through the informed choice process, through services and supports you choose. VR is all about your choice. It's all over the regulations. VR services must be consistent with the person's skills, abilities, preferences, and informed choice. So it's things that you choose, the job goal that you choose, the services and supports and providers that you choose. So VR is all about choice. You can work with ORS to help you identify the jobs that match your interests. You can identify the things from getting there, and then you access the supports, those vocational and other training supports, those assistive technology, the medical and mental health care, the transportation, the services to family members that help you get to your job. So everything I've shown you, I hope has shown you two things. One, ORS can help you work. And two, ORS can help you live. ORS can help you gain the skills you need in decision-making and the supports you need to take care of yourself, to be independent and avoid guardianship. So if guardianship's unnecessary, remember, I've always said there's nothing wrong with guardianship when it's appropriate, but we should be trying to avoid it when it's unnecessary. When a person can take care of him or herself with appropriate supports, they should be getting those. So my whole thing with VR, as with anything else, is we find the supports that people need. And VR can provide more in more ways, in more times than any other program. Now, look, sometimes you and VR are going to disagree. And I want to spend a couple of minutes on this one because there are a couple of fallacies that you might come across with VR. And I want to prepare you. Okay. If you and VR don't agree, you have a right to appeal. Let's say you say, I want this job goal, and VR goes, I don't think you can make that job goal work. Well, you can file an appeal and have a trial and ask a judge to overturn VR's decision and make them serve you. Here's a couple of biggies. You may hear from VR that they only have to serve you for 90 days. VRs across the country say, our job is to help you find work. And once you are successfully employed for 90 days, we close you. I want you to be aware of that. You might hear that. And if you hear it, it's wrong. The regulation says this. If 1, you reach your job goal. 2, you are satisfied with your job goal. And 3, you agree that you have met your job goal and it's going well, then they may close you after 90 days. That means if you've met your job goal, but realize that that's not the job goal for you, that you're cut out for more, they can't close you. You have a veto effectively over closure if you've been working. That's my example of the engineer, senior analyst, not engineer. He was an analyst. His job goal was senior analyst. When he was promoted to analyst, VR tried to close him. And we sued. We went to appeal and said his job goal is senior analyst. You can't close him until 1, he meets that, and 2, he agrees it's appropriate. Another example, I worked with a young woman who VR had the gall to say had maxed out her abilities at dog walker. She was 22 years old and wanted to be a veterinarian technician. And they said, they got her a job as a dog walker. And after 90 days said, we're closing you. And we said, wait a second. Her job goal is veterinary care. She's working as a dog walker, but she does not agree that she's met her job goal. They cannot close her. The regulation says you have to agree. I cannot stress that enough. 2, you might also hear a fallacy about a thing called supported employment. Supported employment is a very intense VR service. It's for people who need a lot of help to work. Okay, it includes job coaching and much more. So supported employment is a big deal. And VR tells people that you are only entitled to 180 days of supported employment. And once you have that, you don't get it anymore unless you have a waiver. False. The regulation says you are only entitled to 180 days of supported employment unless you need more to retain your job. So you have the option to say, I need more, and prove it. And that's important because you're going to disagree with VR. VRs across the country either don't know their own regulations or don't want you to know their regulations. I always say with VR, that's why I say don't roll your eyes, know your rights. You got to know the rights more than them. That's why I keep giving you these regulations. Okay. I have had so many times. I had one case with VR where my person needed a sign language interpreter. She was deaf, and VR said, we don't provide sign language interpreters. And I blinked my eyes a couple of times and I said, you know, the last time I looked at 34 CFR 361.48, one of the required services was interpreters. They went in the back, they read it in a book because they weren't computerized yet, and they found that. So you have to know better than them. So you have a right. If VR says either we're not going to support this job goal or we're not going to give you this support or service, you have a right to appeal. You have a right to say, I disagree, and I want to appeal that decision. VR has to give you a letter when they deny you, And that letter has to tell you all about your right to appeal, all the things you can do. And if you want to file an appeal, you got 30 days from the day of that letter to do it. And you'll have options when it comes to appeal. And these should all be on that letter. And everything I got here comes from ORS's website. And this is, again, where I make a plug for Disability Rights Rhode Island. Their CAP program, or Client Assistance Program, can provide you with at a minimum information about this. But you have different levels of appeal. You can, if you want, do something informal, like an administrative review, where you basically ask a supervisor to review the decision. And the supervisor can say, we got it right, or we got it wrong. They have 15 days to do that. You can ask for mediation. People never do this enough. If you and VR disagree, you can say, I want to go to mediation about this. And then VR has to pay for a mediator. ORS has to bring in a third party, a trained mediator, to try to help you guys work it out. I've had cases resolve in mediation, and they've got 15 days to do that. Or if you want, the one that I do the most of is a hearing, a trial. You have a right to ask for an appeal, for a trial, for a judge to make a decision of whether you're right or VR is right. I am in VR litigation as we speak over support and services, but that's literally a trial. The judge, there is evidence, there is argument, and the judge makes the decision. They said either VR is right or you're right. After that, everyone has a right to ask the VR director to review that decision if they want. The director can then say, I think the judge got it wrong. They have to have clear and convincing evidence on that. And finally, you have the right to go to federal court. The last step in the process is judicial review. The due process hearing is before an administrative judge. Judicial review is an actual lawsuit in federal and sometimes state court. So those are your appeal options. And it's important that you know there are deadlines. In general, you have to file one of those appeals within 30 days. And VR is required to tell you about that. Okay? If you want to file an appeal, I have to say again, it's a really good idea to talk with Disability Rights Rhode Island. Okay? I'm not saying Disability Rights Rhode Island can take every case, but they can give you information about the system. They can provide you with that. And ORS has to provide you with an explanation of what to do if you want to appeal. They have to provide you with accommodations if you request them. I was in a trial today. I got home at 5 o'clock where we had not one, but 4 sign language interpreters. So when you file an appeal, what you want to do is tell VR, here is the decision you made. Give them a copy of the letter. I disagree. I want to appeal. That should be all you have to do. Okay. And then you pick your thing. Do I want administrative review? Do I want mediation? Do I want due process? So let me tell you a story that brings all this together, what I call a VR story. I worked with a young man named Vinay. Let me use his name. VD is what we put in the journal, but this was covered in a journal article. So Vinay was 18 years old. He was a high school graduate. He had an intellectual disability. He went to school in New York and graduated high school. And he lived in Washington, D.C. He was going to school in New York, lived in Washington, D.C. After he graduates, he comes back to D.C. and he applies for services for VR through DC's VR, what's called the Rehabilitation Services Administration. Okay, so everything we talked about before, he went and applied for services, and VR qualified him for services. They found the 4 things. He had a disability, he wanted to work, the disability caused a barrier to employment, and they could help him. And they came out and they found that Vinay's barriers, where he had difficulty with interpersonal skills, he had difficulty with self-care, and difficulty with organization. Everyone agreed those were his barriers. So they said, what do you want to be? Vinay said he wanted to be a physical therapist. That was his job goal. And RSA agreed. They said, we think you could be a physical therapist, but you're going to need additional training. You need to find additional training for this. So remember 34 CFR 361.48, training is a required support. So they said to Vinay, give us some ideas of where you can find training. So Vinay and his brother find another school in New York that does specialized training, that has, it's a residential school that provides during the day job training, including a certification in physical therapy, where it included internship opportunities where he could work in a physical therapy office. And during the nights and weekends, provided life skills training to help people become more organized, better at communicating, to balance a budget, to use transportation. Everything was hunky-dory. Everyone was on board for this school until they saw the bill. The bill for the school was $73,000 a year. And Vinay said, I did everything that you said I was supposed to do. I found the school. The school was actually a qualified provider under DC's system. This school does exactly what I need. It provides physical therapy training and it helps me with the self-care things that you said I'm lacking. So please approve and pay for this school under 34 CFR 361.48. What happened? RSA said no. RSA refused to pay at the last second after, by the way, he had committed to attending the school and signed the contract. RSA at trial, we went to trial on this. We appealed it and went to an impartial due process hearing. Remember your options. We first asked for mediation and that didn't work out. So we went to an impartial due process hearing, a full trial before an administrative law judge. And VR's position was we should not have to pay for the school because the school provides life skills. That's not employment-based. That taking care of yourself and taking your meds and working on your hygiene and using transportation and balancing a budget is not related to work. They're life skills. Therefore, we don't have to pay for the school. So we did a week of testimony about how those were the exact things Vinay needed to work. In fact, remember, they said his limitations were in organization and self-care. So we had people testify that Vinay needed to be able to balance a budget, for example, to be able to maintain a job, because you go too far in debt, you're not going to be able to work. If you are not able to take care of yourself physically, you're going to miss work and get fired. If you can't use the bus system, you're not going to be able to get to work. So we had a whole case about whether those things are job skills. And after a week, and the whole thing took a year, the hearing officer ruled for us. The hearing officer said Vinay was right, because the hearing officer said that Vinay needed fundamental training and basic skills necessary to get a job. And they said that those things they provide, those independent living skills, self-care and money management and transportation and medical care, are exactly what he needs before he can work. Remember, VR has to help you prepare to work. If you're not ready to work, they have to help you get the skills you need to work. So the judge said those things, those life skills, are work and work related. And not only did the judge make them pay for the school, they made them pay for the dorm. We weren't even asking them to cover the room and board. And they did, because the judge said it's New York. You got to live up there. And that's part of the program. So they had to pay $73,000 a year for him to attend that school because Vinay needed life skills. So this case, I'm not bragging. It wasn't done to tell a story. It was done to show you how all the VR things fit together. He needed help to prepare to work. He applied for the VR program. He was found eligible because he had a disability. It was preventing him from working because it prevented him from having self-care and organization and independent living skills. He found under 34 CFR 361.48 the support he needed to help him get the job that matched his interests and skills and preferences that VR agreed was an appropriate career. So under the federal regulations, the things that he needs to get that job, to overcome those barriers, VR has to provide. And at the end, when VR refused, he used his right to file an appeal and did, and the hearing officer won. I'm proud to say he's working today. So we can use VR to do all those things. What I want you to know, it's not just about work. VR fits with all those other supports. Our last presentation next year is going to be about really how to bring together the supports and services. What I want you to know about VR is it helps people all through life. And one of the places where VR really helps, and I'm talking right now to parents of students with disabilities, is VR can help so much in school. VR is required to become involved in special education for students as early as possible. That means don't wait. Don't wait for the school to refer you. If you think your student can benefit from VR, go apply. I've had people apply at age 14 because that is when as early as possible is. And if you invite VR to your IEP meeting, they have to come. I've had VR across the country say, we can't make it, we're busy. My new answer is Zoom. It's no longer a problem to make a meeting. The law says they have to come. And for kids in school, you have an amazing opportunity to use VR. It is called pre-ETS or pre-employment training services. And you know where you're, yes.
Jonathan, hi, it's Morna, and don't want to interrupt Priyats, but I thought it might be good to mention this comment from Linda Flesher, which a couple of people might be thinking. She says, but he must have had enough intelligence to do that job. I wondered if you could speak to that just a bit.
Well, sure, he did. And that's the whole point, where you have to have VR agree that your job goal is appropriate. And that was the interesting thing about Vinay's case, is no one doubted he had the aptitude to be a physical therapist. If he did not, then VR could have said, we're not going to support that job goal. He could have appealed that. But remember, VR only has to support a job goal that it agrees is appropriate for you, or a judge makes it support. So this is a chance to use that supported decision-making to come together to pick that appropriate job goal. But that's based upon your skills and abilities. If, for example, I want to be a senior analyst and they're thinking analyst, I need to go through those job skills that make up a senior analyst and show that I have the ability to meet them. It's why I don't like the F jobs unless the person truly wants it. People with disabilities, particularly people with intellectual and developmental disabilities, get pushed into these F jobs. And if you want to work at Chipotle, it's great. But I've had so many examples where people with ID who are persons who love working with people get shunted into night janitor work because that just happens to be what VR is used to putting people in. And to me, that's a sin. You have a right to say, this fits my skills and abilities. You have a right to ask VR to do an assessment. In fact, I always ask VR to do what's called a vocational evaluation, to see what my skills and interests might correlate to in a job. So yes, you do have to have the brains to do that job. But when you do, you should be given the opportunity to get that job. So now, pre-ETS, again, my favorite program in VR because of things like this. And where do we find pre-ETS? In my favorite regulation, 34 CFR 361.48, the regulation that says everything VR must do. And here's something that's amazing. The pre-ETS program requires VR to serve every single student with a disability of transition age, so 14 or 16 and up, okay? That means every student with an IEP, every student with a 504 plan, VR is required to provide them with supports and services, whether or not they have a case open with VR. VR is supposed to come to you. Yes, I know that often they do not, but they are supposed to come to you. And look on your screen at what pre-ETS includes. Job exploration counseling. What kind of job might you be interested in based upon your supports, your interests and preferences and skills? Work-based experiences in school, after school internships and training, including integrated employment to the maximum extent possible. We may have to help you find a job, or have to help you find training programs to help you find work. Counseling on opportunities for post-secondary education. They have to help you get ready for college or post-secondary ed, like vocational training school, help you identify what might fit. They're like your guidance counselor. Workplace readiness training to help you develop skills so you can be ready to work. And look what that includes: social skills and independent living skills. That means they're supposed to be teaching kids about interpersonal relations, about organization, about independent living. And what's included in independent living? Self-determination, so decision-making. And finally, instruction and self-advocacy, ways to do person-centered planning, including hooking you up with peer mentors who have been through the system and can help you get through the system. And this is the regulation that says if you invite them to an IEP, they have to come. So
Jonathan,
yes,
quick question while you're describing PREETs. Aisha Shazad asks, does PREETs work with dropout prevention as well?
If you are in school and you have a disability, 504 or IEP, they have to help you work. I would suspect that dropout prevention falls very nicely under counseling on opportunities for transition. It falls very nicely on workplace readiness and self-advocacy skills. Because you know what? Dropout prevention includes, if you stay in school, you'll find a better job. And we're going to help you develop those skills. It's possible that someone is thinking about dropping out because they haven't found the right supports and services, because they haven't found the right therapy for their social skills, or haven't gotten the right approach on how to advocate for themselves. That's what PREETs should be doing. So many VRs say we provide PREETs by providing bi-weekly presentations. That ain't PREETs. Look at your regulation. That's what's required. I would consider going to VR and saying, I want my kid to get this. So when can you, VR, provide my son or daughter with some social skills and independent living skills training? Oh my goodness, we don't do that. 34 CFR 361.48 says you do. And when I talked to educators, and I talked with a group of educators in Ohio about this yesterday, I said, my God, you should be demanding that VR come to your school. It takes pressure off teachers. And for parents, it means you have two areas that can help you. So yes, PREETs should be helping you across the board, with the idea being that we can use Voc Rehab. That's been my whole goal for this hour, to show you all the ways that VR can help. It's not just work. VR is about life. VR is about self-determination. VR is about social skills. VR is about independent living skills. VR is about decision-making skills. VR is about avoiding unnecessary guardianship. And yes, VR is about helping you find the right job for you. And that is my email on your screen as always. I am happy to answer all questions you have for the rest of the night, but please remember my email, because you may not have a question right now, but one may hit you later, and you can always email me at that address. And with that in mind, what questions can I answer?
Jonathan, can you hear me? This is John Souza.
Yes, and before you begin, John, I
Yep.
saw a hand raised from Jamie Harris. Man,
Oh,
we can
okay.
absolutely go after
Sure.
John finishes, but I would suggest don't do the hand raise thing. Just unmute and ask your question. But Ms. Harris, you can go right after Mr. Souza does. Go ahead. Same thing to you, Ms. Fletcher. You don't have to raise your hand. Just go after Ms. Harris. Go ahead, Mr. Souza.
So I have a question about interruption of the VR process. Concrete example, I have a son who was in VR, was going to go and become a college professor. He almost became that, but the program that he was in was dropped by the school, and he got a job in some other field, became ill, and has been very seriously ill for 20 years. Just last week, he got a new kidney transplant. And assuming that everything goes right, he will be ready to work again in about a year and a half from now. In his case, when he goes back to VR, are they going to look back and say, you know, my God, we spent a lot of money on you already. Sorry, you've had your one bite at the apple, or will they just move him right along?
If they do, I'd appeal the hell out of that. There's nothing that allows them to do that.
Okay.
A person can, for example, let's put this in a different kind of light. Let's say I go to VR. They help me wonderfully and I meet my job goal, and I agree I met my job goal, and it's going great. And then a few years later, I get into an accident and can no longer do that work. And I go back to VR and I say, I'd like help getting a new job goal because I can no longer do the old one. They can't say, tough, we did you already. They have to serve every person who meets those 4 characteristics without regard to age. They cannot establish what's called a residency requirement, like what county you live in. It just is those 4 things. So the answer is no, they cannot do that. Ms.
Okay.
Harris?
I just had a question. If criminal history was a disqualifier to say that you're incapable of working.
No.
Okay.
The answer is no. But if my job goal is something that I might be disqualified from because of my criminal history, VR doesn't have to support it.
Okay.
So I've got an unfortunate history that would disqualify me from being a direct support professional or working with kids. VR does not have to support a job goal that I cannot get because of it.
Okay.
But absolutely not. In fact, I have back in the day argued that VR should be directly involved in reentry programs to the community because work is part of reentry.
Sure.
Ms.
Thank
Fletcher?
you.
And Ms. Fletcher had her hand up.
Hi. The program sounds fantastic. And yes, you need to know the law that I've known for a long time. My son's 28. But I can't imagine a lot of this applying to someone who can't read fluently and write fluently. And the jobs that might be available to him might be those 4F jobs.
It might be. There's nothing wrong. There's nothing wrong with a 4F job if that's what a person wants to do and that meets his or her skills. Nothing wrong with that. What I'm saying is just make sure that your job goal is one that matches your skills and interests. There are plenty of people who want to work in those positions. I'm not denigrating those positions. What I'm saying where the sin is when we assume that people can only do those positions. But the job should meet your skills and interests. And there are some people who those jobs absolutely do. Nothing wrong with that.
Okay.
Other questions? Mona, would you like to tell them about CAP? I love the CAP program. I know I've kind of foisted stuff on about contacting Disability Rights Rhode Island.
No, actually, I'd love to invite Kathy Sansonetti to come on screen here and talk about it. She heads up our CAP program and does a phenomenal job. So Kathy, maybe you can unmute yourself and say a few words.
Hi, everyone. I'm Kathy Sansonetti at Disability Rights Rhode Island. I'm one of the attorneys in the office, and I work a lot on the Client Assistance Program, or CAP. And you can call me if you have any questions. I'm happy to go over anything specific or that we've talked about tonight. There's some nuances that might apply to Rhode Island specifically or to your case specifically. And we can help you with that. We're free to talk, I'm free to talk to. I also run our intake department. So if you call and your issue comes in, there shouldn't be a lot of time for us to be able to get back to you. And then, of course, assess your situation. There's been some really good questions here from the audience tonight regarding pre-ETs, reentry, as well as some dropout prevention. Those are all really great questions and topics of interest and things that we work on with the ORS agency to make sure that they're covering the ground. So I'm happy to talk to anyone who has a question and to see if we can help you with your issue. And if there's anyone that has a question now, I'm happy to try to jump in. I don't want to steal Jonathan's amazing thunder here. And I definitely agree with so much of what you've said, Jonathan. It's an excellent presentation, and you've cited to some of my very favorite regulations as well.
That's how you know you're a disability rights person, is that you have favorite regulations. It makes us a lot of fun at parties.
Well, I think it does. And I think people, when they start to know that they have rights, I think you started this presentation by saying that VR doesn't sound like anything people like until they start to realize that they have rights and they can harness those rights. and that they can use them to their advantage. And sometimes an advocate can help you with that. That's what we try to do. And we are definitely in a small state, we can actually work with our VR agency pretty closely, and we have a good working relationship with them. And lots of times we can resolve things very quickly without the need to go further. So anyone who has a question for us, we're here for you. Thank you.
That's great. Well, to those of you who came again, thank you. I would strongly encourage you to contact Catherine in Disability Rights Rhode Island with more questions about Voc Rehab. I think it is a vastly underused service. And I think it's one of the most important things for people with disabilities because it's easy to be eligible and it's so broad what it can do. I always say that Voc Rehab is really the only program I know of that's required to maximize your potential. I hear special education, specifically school attorneys, use this ridiculous phrase that we don't have to give you a Cadillac when it comes to special education. They love saying that. All we have to do is provide educational benefits. We don't have to provide a Cadillac. I have more than once told the judge, I don't want a Cadillac, I just want a car that runs. But in VR, they kind of have to provide the Cadillac. They have to maximize your abilities. That job goal is the one that fits your abilities. They could not tell Julie that she could only be a paralegal when she had the ability to be an attorney. So VR can build you. You can have steps along the way. I have argued with VR that there can be stepping stone jobs. If my goal is to be up here, maybe I need to learn some skills down here. So maybe a job at Chipotle is going to help me with customer service and interpersonal skills while I build my abilities to get another job, a job that has higher responsibilities. I think VR ought to be able to help you do that because it's all about finding the job that fits for you and the supports and services to help you get there. And just a quick plug, I see that one in the chat room. Our next one is January 6th. Our next presentation is going to be about, again, a how presentation, and specifically about healthcare and, over a broad term, life planning. We're going to talk about supported decision-making when it comes to managing health throughout life and some money management issues, but I think are the two last frontiers for people with disabilities, the two that everyone always says they can't do. What about healthcare? What about money? We're going to talk about supported decision-making and that on January 6th. And with that, I think if there's, again, I'm happy to answer any more questions, but I don't want to keep anybody longer than they want to be here. So last chance, folks, what else can we talk about? I've answered all your questions, and that's a compliment as well.
You certainly was highly informative as always, Jonathan, and also extremely inspirational. So thank you again. And we'll have to wait an entire month for your next presentation, but we'll be eagerly awaiting that. Everyone, we have the registration link up, and I know Bruce will be sending it out to folks again. So we look forward to seeing you all on Thursday, January 6th.
Thank you
Happy
so much.
holidays, everyone.
Happy holidays,
Jonathan?
and thank you again. We'll see you next year.
Yeah, thank you.
Goodbye.
Take care, all. Have a good evening.